611, dry drowning is not a medically recognized term, but when the words are used, doctors are referring to a drowning-related injury. The complications could be deadly. 7 News' Olivia Donnelly sat down with doctors at Bon Secours St. Francis to discuss what you need to know to keep you and your family safe.
You may have heard of the term dry drowning, usually referring to when someone inhales a lot of water and later on has trouble breathing.
We refer to things as drowning-related injuries, and this typically refers to conditions and complications associated with aspirating water into the lungs. Having water inside your lungs can affect the ability to provide oxygen to the rest of your body.
That's Dr. Jay Blankenship, the medical director of emergency services at Bon Secours.
Water is swallowed into the lungs, and so the person doesn't obviously drown, but they have aspirated water into their lungs and then can develop complications in hours and days following that submersion event.
He says complications associated with drowning-related injuries are extremely rare
and almost never come out of nowhere. So people who are not having symptoms very rarely suddenly get sick later on.
Early symptoms include things like persistent cough,
shortness of breath, difficulty breathing, chest discomfort, unusual fatigue or change in behavior.
Dr. Blankenship says that it's uncommon for a drowning-related injury to result in death without any warning.
And so that's why it's very important to monitor people, and if they're having persistent or worsening symptoms, to seek medical attention.
If you accidentally swallow water and you cough a couple times afterward,
that's perfectly normal. But again, it's watching people over time. If it's a persistent cough, if the cough is getting worse, those would be symptoms that would be concerning.
Because delay in treatment could exacerbate issues.
The concern would be that water in your lungs would impair oxygen exchange, which could result in hypoxia, low oxygen levels, and in the worst case, respiratory distress and respiratory failure.
Dr. Blankenship says that it starts with prevention.
So the best way to prevent drowning-related injuries is to prevent drowning. Supervision for children around all bodies of water, learning to swim, the use of life jackets when appropriate,
and avoiding distractions.
You can't look at your cell phone and also supervise children that are swimming.
For this week's Ask the Expert, I'm Olivia Donnelly.
Dr. Blankenship says children are especially vulnerable for drowning-related injuries. The same goes for adults and children with lung problems like asthma or COPD. To submit a topic for our Ask the Expert series, head to WSPA.com.